Okay, hello, my name is Marlene. I'm a student nurse. Today I'm going to be doing a central venous access device dressing change. So the reason why I'm going to be doing this is because an order is there for the dressing to be changed once a week or as needed, and today is the day. So I'm going to gather my supplies. So what I have is my dressing change kit, my bio patch, and my transparent dressing, and my mask. So let's go ahead and go into the patient's room. So we're gonna knock, we're gonna provide privacy and hygiene and introduce ourselves. So hello, my name is Marlene and I'm a student nurse today. So I'm here to do a dressing change. And can I have your name and your date of birth, please? Okay. So are you having any pain, from 0 being no pain at all to 10 being the worst pain ever? No pain? Okay, I'm glad to hear. So as mentioned earlier, I'm here to do a dressing change on you, okay? So will you be able to assist in the dressing change, such as I'm gonna have you turn your head to the opposite side of the dressing, okay? Will you be able to do that? Okay. And if you're not, I can provide you with a mask, okay? And also, while I'm doing the dressing change, I'm gonna have you in a flat position. Will you be able to tolerate that? Okay. And are you allergic to anything? No allergies? Okay. So let's go ahead and hygiene. I'm gonna go ahead and turn your head to the side, please. Okay, put on my mask and put on some gloves. Okay, so now I'm going to go ahead and carefully remove the old dressing, bio patch, and tape by carefully pulling it towards the insertion site. And also I want to be really careful that I do not dislodge the catheter. So carefully. Okay, now that I have it removed, I'm assessing the site for any signs of infiltration, inflammation, or infection. And I'm going to get rid of this. I'm going to grab a measuring tape, and I'm going to measure, because I want to make sure that according to the previous documentation that the catheter hasn't moved. Okay, so I'm going to be comparing those measurements. So now I've already thrown away the old dressing. I'm going to perform hand hygiene, and now I'm going to get ready to open my sterile items. Okay, so I have my dressing change, bio patch, and transparent dressing. So I'm going to open my sterile kit. Okay, and I have done this on a disinfected table. And I'm going to open my bio patch prior to putting my sterile gloves, making sure it's not contaminated. Putting it like that. I don't know if you can see that. Oh, I don't know how that's gonna happen, but okay. I'm going to take up my sterile gloves. Okay, make sure I open it without contaminating. So now I'm going to oh, these are tiny. Whoa, these are really small. So always make sure to get your size. Okay. Okay, so all done. So now I'm gonna go ahead and grab my my sterile cleaning supply, and I'm going to clean the site, the insertion site, the catheter itself, and the sutures. Cleaning it, making sure, and then after that, making sure that it air dries. Do not blow on it, just let it air dry. And I'm assessing if it needs to be cleansed again, but I'm assessing it and it looks good. It doesn't need to be cleaned again. So now I'm going to grab my supplies. I'm going to grab my bio patch because it had one before. So I'm making sure that it's bio patch, take off the stickiness. And it tells you which side to put it. It has a slit. So I want to make sure to take off the stickiness and put it to stabilize the catheter. And now that we have put that to stabilize the catheter, we're going to go ahead and apply the transparent patch. Transparent dressing. So we're going to do that. And making sure that the slit goes over the catheter. Do you see that slit? Okay. To secure it, we're gonna make sure, and that way we can assess. Okay. Take this off. Okay, and so using this, we're gonna label our dressing with our initials, date, and time. Okay, and you're all done, Mr. Jack. Get rid of this. So while doing all that, I make sure it is very important to make sure that it does not become dislodged from hygiene. Okay, I'm gonna lower the bed. Do you want your head up? Okay, I'm gonna put the head up, and I am going to give you your call light. And is there anything else I can do for you before I go? You're okay? I'm gonna get rid of my stuff from hygiene, and that is all.